Thank you, Director Lopez. And before we turn to today's topic, which are the directed health measures for the month of June, we want to acknowledge that there are many people and organizations in our community that are providing healthcare and public health-related services, from our hospitals to our pharmacies, from our long-term care facilities to our home health aides, and from our epidemiologists to our therapists. We owe a debt of gratitude to a huge range of service providers in our health space, both public and private. We are fortunate to be joined today by a critical partner in this space, our local blood bank. Earlier this month, the Nebraska Community Blood Bank issued an urgent call for blood donors, with the local blood supply being dangerously low. And joining us by Zoom to address this need is Erica Busta, the Marketing and Community Relations Specialist for the Nebraska Community Blood Bank. Erica, over to you.
Thanks so much for having me, and we appreciate you sharing this need with our community. As we approach Memorial Day weekend, we normally see a drop in blood donations, but we really hope that we can have more people in our community come out and donate and support our local hospitals. Right now, our supply is at about a 4-day supply, and we'd like to get it to be a 7-day supply. And that is just an ideal way to support our hospitals as we do see those elective surgeries ramping up, and just to make sure that there's always blood available when patients in our community need that blood. We need all blood types. So if you aren't sure what your blood type might be, if you've never donated blood, we would love to have you come and donate. We do encourage donors to make appointments. That helps us to have social distancing measures in place and keep staff and donors safe. We also really want donors to wear a mask. If they don't have a mask, we can provide them as long as supplies last. We're also taking a lot of other different safety measures, including temperature checks at the front door and rigorous cleaning practices between every donor, as well as spacing out appointments more than they normally would be. Part of the reason for our low supply is because we've had to cancel nearly 200 blood drives since March. And blood drives make up nearly 50% of the blood supply in our region. So we really want to see donors come out to our local blood donation sites. And we have 3 in Lincoln and 1 in Omaha. So there's lots of good opportunities to donate. And as the month of June begins, we are looking to restart those blood drives in the community with all the safety measures in place as well. We want to make sure that the public knows that donating blood is safe and essential for taking care of people in our community. And in terms of eligibility, as always, you're only eligible to donate blood if you are feeling healthy and well that day. We want to make sure that all donors are aware that we don't want anyone in our building who might have any symptoms or temperature, anything like that. So we want people to be extra vigilant for those symptoms before they come and donate blood. All our other eligibility questions are in place. So you need to be at least 17 years old or 16 with a parent permission form, 110 pounds. We have a series of other eligibility information on our website, so you can check on those. And if you aren't sure whether you're eligible, if you're taking a medication or just have a question, you can feel free to call us and one of our nurses can answer those questions for you. And the best way to sign up to donate is to call us. It's 402-486-9414. And we encourage you to make those appointments once again. Another great thing that we're doing to help combat the coronavirus in our community is to collect convalescent plasma. And so if you are a recovered patient with a positive test result for COVID-19, we encourage you to go to our website. There's a spot right on the homepage where you can fill in a short questionnaire about your coronavirus symptoms, to upload your test result, and then one of our staff members can help you to sign up to donate convalescent plasma. And that would allow you to help someone who's currently hospitalized with coronavirus, because the antibodies in your plasma that your body used to fight off COVID-19 can help a patient in the hospital in our community. We've already seen great results for helping patients locally with plasma that we've helped to supply from other parts of the country. And we want to see us build a larger donor base of people here in Lincoln.
Well, thank you so much.
That's all on our website. Yeah, thank you.
Thank you so much, Erica. We really appreciate your work, and we look forward to talking to you more about convalescent plasma donations